Thank you so much, Megan. Appreciate it. I feel less burned out just listening to you. And I think the resources are obviously helpful. I just wanted to ask a question, and we can take a few more questions before we break for lunch. But, we have providers and physicians and healthcare providers from different kind of practices. So employment model, self-employed, universities, et cetera, VA. You know, but when we talk about the system as a whole, we think about the U.S. healthcare system. Sometimes that feels overwhelming in and of itself, right? And from a day-to-day standpoint, you mentioned a few strategies, but is there anything that you suggest from an individual standpoint that somebody should do, like when they wake up in the morning, how do they approach the day, how do they prepare for the following day? I mean, what are the types of things you give counsel on regarding that?
Okay. Yeah, I mean, quick, tangible things, right? So do not look at your phone the first thing you do when you wake up in the morning. Don't read the news. Number one, especially if you're feeling stressed and burned out. I know this is incredibly difficult. The other thing is just take 2 minutes in between patient visits, or carve out a buffer time, 1 minute to not look at email and just sit there and just take a minute in between meetings or something like that. So that's another thing you can do. Um, and I think to focus on the patient, even when the patients are challenging or very complex, you can kind of reframe it to some degree, right? It's like, wow, that patient actually felt comfortable enough to tell me that they're kind of thinking about not wanting to live anymore, or whatever it is. So it's not that's also like a trusting relationship potentially that they have. So there's lots of things like that I think you can do.
And then in terms of in terms of the kind of any, you mentioned some resources. What about things like applications or programs? Have you seen things that like healthcare providers can participate in? I don't mean just like Calm or Headspace or things like that, but maybe that is something you recommend. But those tangible strategies to take a breath, kind of center oneself before moving on to the next crisis du jour.
Yeah, crisis du jour. That's right. Yep. I mean, these resources have some of those. They show the kind of at the national level different wellness you can enroll in, and it's also confidential, which is very helpful and outside of your workspace, which can be helpful. I mean, most healthcare systems, UCLA is a great one. I think great for physician wellness, where they are doing multiple rollouts of different coaching and peer coaching and all kinds of things, and that's offered to us. And I think. I'm trying to think if there's other programs out there like that would be, but I think they need to be geared towards physicians and health or healthcare providers. I don't that's I wouldn't do a Calm or something like that,
Yeah.
because it's we're in such a unique context and our profession is so different that there's so actually the Mayo Clinic has a great course. It's called the Compass program, and you can look that up. And that program, it can also be applied, and it's kind of a series of changes, but also like courses you can go through as well.
Yeah, thank you. And one of the things that, like, I appreciate you saying that about physicians or healthcare providers being in a unique context is that, we most often, especially in GI, we're seeing patients when they don't feel well. It's unusual, except maybe for a screening colonoscopy, just to be seeing somebody that's asymptomatic. So it's something to keep in mind. Please go ahead, second microphone there.
In terms of moral injury, perhaps in private practice, the biggest factor that we encounter is the insurance company, who have intruded into the decision-making process. And we realize clearly that their priority is company profits and not the health of our patients. Do you have any suggestions as to how to deal with that?
Nope. No, no, I mean, yeah, it's maddening. I know it is. I mean, I feel it too. I don't have it. I mean, besides policy work and advocacy, right? So anyone that you can do, anything you can kind of sign up for, like it has to be at like that policy level. I think with when it comes to insurance companies. I mean, I was from the world where we didn't have mental health parity coverage for my patients, right, for a long time, and that finally happened. So change can happen, but that is a very big mountain to climb. But people are doing it. So I would say take that disappointment you have and that struggle that you have, and use it to find ways that you can kind of join an advocacy, or sign a petition or something like that.
Gil?
Yeah, this is really piggybacking on a lot of the comments. Thank you very much for really insightful conversation around this. And maybe it's a question for both of you, is what about the next generation of healthcare providers? How do you see the systems changing? How do you see our roles is changing the systems, investments in AI, legislation to change prior auth rules? Like, where is this all going and how might this impact the future of trainees?
Well, first the expert.
I don't know if I'm
Okay.
definitely not an expert in AI, but you all are.
Well, I was going to say is I think for people who are in positions where we can potentially have some influence, I think we have to kind of um, anticipate the differences in our generations. Like taking care of patients. As Megan pointed out, there's an inverse relationship between age and burnout. And I think many of our trainees we see in medical school, residency, and now fellowship have trained during the pandemic, which was like an unusual circumstance. We see higher rates of depression, anxiety among trainees at very, very high levels compared to anything I've seen before. Maybe people weren't looking, we were just joking with Adrian. Maybe it's like Gen Z is different than Gen Y versus Gen X, et cetera. But the reality is that instead of complaining about it, I think we have to kind of deal with it. So it's about providing resources, building in support systems for trainees and young graduates, anticipating that people are going to potentially move from job to job. I think it's a dream to say, oh, I'm going to start a job and then retire in that job. But I think people are going to continue to look for opportunities that provide them more flexible work schedules, working from home. We see that Megan and I have discussed that we just hired another psychologist and we hired some more dietitians for our program. But the ability for them to work from home or have some flexible work was a necessity. If we didn't, we wouldn't be able to hire anybody. Go ahead.
John Vierling, thank you very much for this. I think it is an extremely important subject, and I think that the research that you're documenting for our benefit needs to be promulgated more than it is within our profession. I want to follow up on the last answer to your question, and that is a perspective as an academician, having trained medical students, residents, and fellows for decades at this point. And it is the issue in managing, as you've pointed out, anxiety, stress, depression, which is common within our house staff and fellowships. One of the things that has been adapted is a focus on managing the system rather than caring for the patient. And you pointed out several times over the importance of that rejuvenation of our own emotional, spirit when you've cared for a patient, when a patient has exhibited trust in you, the relationships that everyone in this room has had, we're starting to lose that. And we need to be cognizant when we're working with younger people, and many of us do that, and they may be rotating with you or you have responsibility for training them, that this issue of caring for the patient, beginning with the fact you care for the patient before you can provide care to the patient, is essential. If we don't do that right now, I fear that we're going to have very skilled people in managing the incredible burden of the EMR, but they won't be skilled and they won't be personally satisfied practicing medicine.
That's an excellent
Very
point.
well said.
Yeah,
Yes,
well
very
said,
well
John.
said. And I think that with the trainee point too, they're spending. I was reading some data within gastroenterology on this. They're spending less time with their mentors and supervisors and attendings, way less time than older generations did. So there's less face-to-face time. There's with the attendings and the supervisors now, and that's also a burden as well. So I think even if you can inch your way towards that in some capacity, that's going to be helpful bidirectionally, both for the attending and the trainee coming out of it, because you're having much more face-to-face time and building that relationship and care essentially.
It's like Dr. Raju's bio quote. Just thinking about it as you're talking. If you missed that part, he talked about hands that serve are more powerful than lips that pray, or something. That lips that pray. So exactly, it's about service, and there's a personal pride and potentially even rejuvenation if we approach it that way. Easier said than done, right? Because people have bills to pay and there are challenging circumstances. But certainly from a profession standpoint, it's necessary.
I may just add, since you brought that up, recently we lost in our field a giant, Stephen Harrison, who was a giant as a military physician for 25 years, a retired full colonel, and who then went in and devoted his career to building the research infrastructure to study what is now called metabolic dysfunction associated steatotic liver disease. What a mouthful, but the old NAFLD, and now MASH and MASH, MAFLD. But at his funeral, he had among the quotes that he had one where he was on video, and it stuck with me, and I think it is resonant with what you just said. He said, the most selfish thing you can do is to serve another person. And when you learn that, you will understand what the meaning is of your life, what your purpose and your passion will be.
Absolutely. Thank you so much. On that note, it's hard to even top that. So thank you, Megan.